Well, hello and good morning from here on the West Coast. Good morning, Dr. Powell. Good morning. Oh, I apologize. I think I had my volume off, so now I can hear you. My name is Dr. Powell. Thank you for being here today. And if you have the opportunity to turn on your cameras and engage, that would be great. Otherwise, I understand if you, I think I saw someone who was on, yes, in the car. So I understand. Wonderful. All right. My name is Dr. Powell, and I am the founder and CEO for Global Health Leaders. And I will be giving you a little rundown of our programs today and answering any questions you have. So feel free to jump in anytime, put your hand up, or just kind of chime in if you have questions. I'm happy to answer them as we go along. And we're going to go ahead and get started. And we may have a few more people join us here in a few minutes. We had 8 people signed up for today, so there may be a few more people joining us. All right. Well, welcome. Thank you for your interest in Global Health Leaders. We are an international healthcare education organization that we train and mentor pre-health students, pre-public health students through immersive programs in clinical research and medical care. We are focused on ethical global health practice, and our programs are rigorous academic preparation with hands-on experience where you get the opportunity to serve underserved communities abroad and in the US while preparing for your future medical career. The team. First, I'll tell you a little bit about our story and how we got here. This is a photo of me in 2001 in Mexico. I had decided after high school that I wanted to volunteer in an orphanage and in Mexico instead of going to college. I was not sure what I wanted to do, and that seemed like a great way to give back. And while I was there was a little boy who had come there because his mother had recently passed away from a condition that he called purple spots. And months later, contracted the condition. I also contracted the condition. And since I was an American with American health insurance and the ability to easily go across the border into the US to get care, I was able to get quick care quickly. And after some time in the hospital, was able to recover without any lasting effect. However, the little boy who I had contracted the condition from did not have the same access to care. Without record of his birth or any financial means or family members, he was unable to access the care he needed. And sadly, he died from the same condition that I was able to easily get treatment from. That really sparked my interest in bringing healthcare to people and making healthcare accessible. And many years later, turned into Global Health Leaders. I am the CEO and founder. I have nearly 20 years of experience in healthcare and over 15 years in healthcare leadership. I've been awarded the top 50 women in healthcare leaders both in 2022 and 2023. I'm a lifetime member of the Stanford University Executive Circle, a Virginia Piper Fellow, and a member of the American College of Healthcare Executives. Our Chief Financial Officer, Junie, she's an incredibly talented business coach and financial manager. She is a CFO or fractional CFO for startups and large businesses alike. She's a University of Oregon and University of California alum and a former business and financial leader for a global Fortune 100 company. She has chosen to join us because she is passionate about social entrepreneurial projects and wanted to join this incredible movement in supporting both students and individuals in the Caribbean without access to care. Dr. Sosa. Dr. Sosa is our director of research. She is a medical doctor. She also has an MBA, and she is nearly complete with her PhD in global epidemiology. She teaches research at Harvard University T.H. Chan School of Public Health and was recently recognized as a top medical educator in the Dominican Republic. All right, our programs. We have 5 programs currently. So we have a short-term international medical program, short-term international medical and research program, online medical research program for college, both college and high school students, and a medical research mentoring opportunity. We are building right now and coming soon is a rural USA medicine and public health scholars program as well. Today, we will talk about the international medical programs and the online medical research and mentoring specifically. All right, our international medical program is an immersive global health experience designed for our pre-health or pre-public health students to get real-world clinical environment and be in real-world clinical environments and serve underserved communities. We complete in-depth training prior to departure, and then you get hands-on medical and public health experience in the Dominican Republic, assisting licensed physicians in temporary medical clinics in areas where there is very little or no access to primary medical care. You'll get hands-on clinical exposure, you'll get clinical training hours, you'll get time in a different culture and some cultural humility opportunities, and a deeper understanding of ethical global healthcare. The intern program or national medical program details. It's 6 weeks of virtual training, which is 5 weeks prior to departure, and then 1 week in the country, 8 days in the country, and a follow-up debrief kind of training week afterwards. The location is in Punta Cana area of Dominican Republic and online. So the majority of it is online. However, the immersive experience is in the Punta Cana area of the Dominican Republic. The clinical experience you'll get is patient intake, vitals, triage support, as well as working with the doctors. Our doctors are there to train you first as students, and in the process, treat patients. So they will translate everything. They will also ask you to do the exam hands-on instead of them just doing the exam. They are there really to guide you, train you, and give you experience that you can't otherwise get. And in the process, they're able to walk you through the entire assessment, diagnosing, and treatment planning for patients. You'll be supervised by licensed physicians, as well as our experienced global health leaders staff. This is primarily built for pre-med, pre-health, public health, and healthcare administration students. However, anyone who wants to give back and get this kind of hands-on experience is welcome, but it really is primarily built for those pre-health or public health students that are looking for that global health experience. Our international medical program has 100 hours total. It includes 40 hours of hands-on patient care experience that is in the country, in the temporary clinics. That's a full work week of 5 days of temporary clinics. You'll get 20 hours of clinical training prior to going and 40 hours of cultural immersion. The weekly commitment is approximately 2 to 3 hours per week prior to travel for preparation for completing online trainings as well as completing live Zoom or online trainings, and then 8 days in the country. There's a program fee of $2,395, which includes everything that you will need in the country as well as all the training. So that includes your lodging that is shared with one other student with your same legally assigned gender. It is a hotel room with its own bathroom, its own little mini kitchen, 2 separate beds. It also includes your ground transportation in the country to and from the airport, to and from the clinics every day, 3 meals per day, all of the training that you need to be able to be successful, be prepared for travel and for running the clinics, all the medical supplies needed for the clinics, the medications needed for the clinics, a certificate of completion, and for students who successfully complete this program, we do offer letters of recommendation, both from myself and from the doctor that you work with in the country. And we are willing to submit those into portals that you might have for graduate school applications, med school applications, as well as use it to verify your employment history for future jobs. What is not included in that program fee is your airfare. Our students come from all over the world, and so we will make sure that you have the information of where to be and when so we can pick you up. But we do not, it does not cover airfare. closed-toed shoes and scrubs of your choice, and travel medical insurance, which is about $15 to $20 for the entire week that you're in the country, depending on the plan that you choose. All right, our International Medical Plus research is a combined clinical and academic program. This is the International Medical Program with a research project added on top. So it is you complete the full study abroad or international medical internship while also developing and contributing to a medical or public health research project. Now, these are mostly survey research projects or comparative research. We do not do any kind of interventional medical studies or anything, any kind of interventions for study, but we do provide you the opportunity to do public health survey research or epidemiology potentially or comparative studies. Um, you will have the opportunity to get through the entire medical program, plus working one-on-one and in a small group fashion with a research advisor who's a medical doctor, research advisor, either Dr. Sosa or an assigned research advisor. All of our research advisors are medical doctors, have significant experience being published, and are research teachers or advisors at T.H. Chan School of Public Health at Harvard University. In your research program, you will do 14 weeks total of online work. That includes the 5 weeks with the medical team at the beginning, and you'll have an additional meeting with your research advisor and research team each week for those prior 6 weeks. Then you'll go to the country for 8 days where you do the medical program and you gather your research data. Then when you return back home, you have another 8 weeks or so, 7 to 8 weeks of data analysis, writing your manuscript, and submitting for publication if you choose. You will have your research focus will be global health or some kind of public health, potentially clinical outcomes. You'll have a physician research mentor, and you will have the physicians in the country that you'll be working with. This is for students who want the clinical experience and are looking for that research experience, whether it's just the experience of research or you're looking to use it maybe for an internship where you'll get credit for at your university. Many students use this program to get clinical hours, to get research experience, and to get college credit. And so a lot of times this research paper that you finish and manuscript is something that can be turned in for that internship credit quite often. Now that would be credit through your university, not through Global Health Leaders. And this is also an opportunity for students to get published for those who want to be published and have that goal before maybe med school applications or graduate school applications. All right, our International Medical and Research Combined Program is 160 hours total. That includes the same 40 hours of patient care experience, the same 20 hours of clinical experience as the medical program, and the same 40 hours of cultural immersion. But it also includes 60 hours of medical research mentoring, training, and experience. The commitment for this one is between 4 to 7 hours prior and after, before and after the travel. So this is something that takes a little bit more commitment and longer term. And then it's 8 days in the country. The program fee for this one is $2,895. And it includes everything that the medical program includes, which is the lodging, ground transportation, meals, training, supplies, letters of recommendation, but it also includes the individual and group research mentoring with one of our medical doctor research advisors. Again, what's not included is the same things: airfare, closed-toed shoes, scrubs, travel medical insurance. And if you choose to submit for publication, publication fees are not included. There are journals that are free to submit for publication, and there are journals where there is a fee for publication, or there are also fees for IRB approval if you need that. So please be aware that those are not included in this, but we will prepare you for IRB approval and publication if you choose. All right, the schedule is very similar to our medical one. You've got weeks 1 to 5 is online training, about 1.5 to 3 hours for your all team work plus the assignments, and then an additional 2 to 4 hours per week for your research team. Week 7 is in the country. You will arrive in the country on Sunday. You'll have an orientation and team dinner on Sunday evening where you'll do your hands-on training for things like uh, blood pressure, blood glucose, thing that we need to teach you in person. We will teach you online. We will make sure that you have the experience as well, hands-on before going into the clinics. Typically, our clinics are Monday through Friday. Unless there's a holiday, it could change and you could potentially have a weekday off and have a clinic on a Saturday, depending on the timing of your cohort and your travel. However, typically it is Monday through Friday that we do clinics. And then you leave the hotel at 8 a.m., you return between 3 to 4 p.m., and you do the clinic for the entire time in between. Saturday is your day off and your cultural free day, where we will help you organize whatever it is that you are looking for to learn from the country, whether you want to do coffee tasting or do something cultural, learn the dance, go to the beach. This is a day where you get to have free kind of cultural experience, tourist experience. You will also have evenings, Monday through Friday after the clinic, if you would like to choose to do some things as well to explore the culture and the community. For weeks 8 through 16, this is for the research team to continue your research work after gathering your data in the country. Outside of the clinic, as I mentioned, there's a lot to do for Cultural Day, for your opportunity. There's a beautiful dance, merengue and bachata are very common there. In fact, merengue is from the Dominican Republic, and they're very proud of it. It's a fun dance and a great music. There's ATVing. Some parts of the country will have rafting. You will not be close to that if you're going to Punta Cana. However, there are groups occasionally that do go further into the mountains. Beautiful beaches, incredible swimming, and incredible coffee. So wonderful things to try out and experience in the Dominican Republic. All right, those are our international programs. Our fully online medical research program. We do have a fully online medical research program opportunity for students who are not able to or interested in traveling internationally, but want that hands-on medical experience. Our medical research program is specifically for students who have a goal to either be published or have the full experience of clinical medical research prior to maybe applying for a grad school, med school, or as a supplement maybe to some of their academic work. The online medical program, it is the same program for both high school and college. However, for high school, we add an additional 2 weeks because there's more preparation and training that needs to be done. Our high school program is for high achieving upper level students, so juniors and seniors who are high achieving academically and have had experience already in statistics and any kind of other academic writing. Our college program is for university students or recent graduates who have experience already at a higher level with academic writing and statistics. The format is entirely online, so it can be done from anywhere. You will have weekly meetings, one-on-one and in group fashion with your research advisor. You are expected to attend a minimum of 80% of those live. So you will schedule those times with your research advisor for a time that works for you and your cohort. And your team will be working together on an area of medical research, public health, or global health that you will choose to research. Primarily, students in this program choose a unique case from our clinics in the Dominican Republic, and we'll do a full in-depth medical case review of that case with the opportunity to then write it into a manuscript and submit for publication if you choose. However, we also have opportunities where you can access data from all of our clinics, whether it's intake data, medical data, medication data. You can also access information from former students in our database if there's a specific topic that you want to research. You will have a group of 3 to 6 students in your cohort that you get to work together And as a group, you choose one topic to study and write about. The internship online is approximately 80 hours. It's about 5 to 8 hours a week, but it depends on the week that you need to be committed. So there, some weeks are heavier loaded than others, depending on where you're at in the process and how well your team is keeping up with your assignments and the workload. So far, our publication rate is 100% success for high school students over the last 3 years. Every high school cohort who has completed this has been successfully published in leading medical journals such as the European Medical Journal and others. And we have an 83% success rate for college. We've had several college cohorts that have chosen not to publish, but for those who have, we've had a high success rate. In fact, this is a little outdated. We had another couple of published this year, so this is probably closer to 90% at this time. The program fee for this is $1,245. And it includes everything you'll need, your research, the access or your research advisor, access to all the databases that you'll need, and everything you'll need to successfully submit for publication if you choose. It does not include publication fees or IRB fees if you need those. This program, however, funds far more than just your research and your access to this research advisor. When we've had clinical cases, where people need some kind of care, we often have contributed to that. For example, a while ago, we had an individual who needed surgery, and he was qualified for free surgery in the Dominican Republic. However, he had a home with a dirt floor and a mat on the floor for his bed. He did not have sufficient hygiene supplies or a way to recover in a way that would be hygienic. So our team supported him with getting flooring and hygiene supplies and a bed so that he could then qualify for the free surgery that he needed in order to treat his condition. So these fees also go to contribute to the clinics, to the care of the patients that you are writing about, and to the care of the patients in our clinics. So it's far more than just that research fee. All right, the last one is one-on-one medical mentoring. Our medical research advisors are offering the opportunity to work one-on-one with them for your specific project. So we do have students who quite often want to do their own project, or they have maybe they're graduate students who are writing a dissertation and want one-on-one research advising for their specific project. So we created the opportunity recently for one-on-one medical research mentoring. These are our same Harvard-affiliated medical doctor research advisors that will work with you one-on-one. There are 3 options. One is a 4 package option. If you just need some review, you need some editing, you need guidance, you need, on a project you're already working on or something you've already done some advising on, or you have maybe within another university course and just need feedback on. There's a 10-session package where you can work with your mentor for up to 10 sessions over 6 months for more in-depth, maybe developing a project in more in-depth, getting more one-on-one review on a weekly basis for a time while you're writing a manuscript. But this is also going to be more focused on something you maybe already have in the works or something that you need extra support for. The final would be a 16 package where this is a full publication and presentation package. Again, this does not include publication fees or IRB fees. However, this opportunity will take you from conception to final manuscript over 4 months and 16 weeks, over 9 months and 16 packages, 16 sessions. So you can do an entire development of a research study. You can do entire development of a presentation or poster, so that you have mentoring for a longer term for full development of your project of your choice. What happens after your internship? After your internship, you'll receive letters of recommendation from either your research advisor if you're in the research program and myself, or from myself and the medical doctor in the country if you're in the medical program. You'll get alumni portal access. We have an online community for our students afterwards where we post job opportunities that we see. We give insights on different health policy and things that are happening both in the US and globally. You get collaboration opportunities with fellow alumni and other global that are working on global health initiatives or that are in med school, and really have opportunity to go for that ongoing network access. And for those of you who are concerned about the program fee, we do have options for payment plans. We have paid in full, which is if you get offered a position, then you have 15 days then from when you complete your acceptance form to pay in full, and keep it at that base price. We do have 3 to 6 month payment plans, and starting for 2020 for our 2027 programs, we actually have a 12-month payment plan option as well. Um, and there is an administration fee of $200 for putting that together. However, there's no interest. And your full balance needs to be paid 30 days or more in advance for international programs and 10 days in advance or more for the online programs. There's also PayPal credit. If you are interested, this goes through credit approval at PayPal. We've had many students say that they got approved with a 0% interest. And so there's that all that eligibility goes through PayPal. And then we just charge I think a 3%, 3.4% fee because that is what they charge us for administering that. But otherwise, there often is no interest, and that can pay for some up to 24 months for some of them. All right. That is all of that I have for you about the general programs, and open for questions. What questions do you have about our programs? All right, no questions? Okay. Well, if you have questions, please feel free and email us at info@globalhealthleaders.net. It's the easiest way to get a hold of us. Um, Oh, and I do see a question in the chat. All right, Nicole, for the research mentoring program, do we choose the time to meet? Yes. So what you do with your research advisor and the other students in your cohort, you will organize together the time for your group meeting, and then you'll work with your research advisor individually for your individual meetings. So yes, you will determine that, and you get to work with your cohort. So you'll have research advisor and 2 to 5 other students to work with, but we work around your schedule. Um, all right, and Jennifer, wonderful. Yes, so feel free, please email us your questions if you have any more. Info@globalhealthleaders.net. All right, well, thank you all. Have a wonderful day. It was nice meeting you. Bye.